Hello, everybody, and welcome to the Healing with Excellence podcast. This is your holistic health expert, Kimberly Miller, and I have a special guest today with me, Miss Denise Johnston, and she is here to share her healing journey. Thank you so much for being here today, Denise.
You're welcome. I'm happy to be here.
I'm so grateful you are. So Denise has a pretty extensive history in the fitness industry, and she's been a fitness enthusiast, a teacher, a group fitness instructor. She wears many hats. But 2 years ago, she was hit with debilitating symptoms, like almost out of the blue. And so I'm going to have her share her experience, and then we're going to talk through how she actually recovered and how she's back to better than before in this day and age 2 years later. So Denise, what happened 2 years ago?
So it started in May of 2023. I started having like some less restless leg type syndrome type things.
Mhm.
I wasn't comfortable. My legs hurt. When I would go to bed, I had to keep moving them. They hurt. And
Mm.
and I was at a conference and I went home, and on the way home, then my shoulders started hurting. By the
Okay.
time I got home, I couldn't like lift my legs very high. I couldn't lift my arms above my shoulders. And so I was really upset and worried. So I went to the doctor, and that's where he gave me a diagnosis of polymyalgia rheumatica. So
Wow.
it's just supposedly somebody who's older. So I was over 60. Um,
Mhm.
and then, it's just muscles. They don't know what causes it. They don't have a way to treat it. So it was like, we're going to send you to a rheumatoid, person and make sure you don't have lupus or something else like that. And we'll start you on some prednisone. And I was like, oh, prednisone. Yeah, everything I've heard about that is bad. So
Mm.
I was like, yeah, I don't think I want to do that. So I went home and I got on Facebook on a polymyalgia group to see what was going on there. And it was like, oh, yeah, I've been on prednisone for 6 years and I'm down to like 5 milligrams and, blah, blah, blah. And then there's people, well, I've been on it for this long. And they had the moon face and now they had to deal with diabetes and they had other complications. And I was like,
Wow.
yeah, I don't think that's what I want to do. That's when I reached out to Kim because I've known Kim a long time and I knew that she not only did the neuromuscular, but she also had healed herself just by eating the right foods. So that's when I hooked up with Kim. Um, I kind of went behind her back for 1 week and took prednisone that I had gotten because I had not slept in like 2 weeks because I was so uncomfortable and miserable. And then I got some blood work back, and she's like, so what are you doing? Because these numbers shouldn't be like this if you're just resting and eating the food. And I said, well, I took the prednisone for 1 week, but I've already weaned off of it. And she's like, okay, that makes sense. But let's like try to do it this way. And I was like, okay.
Yeah, no, it was scary. When I saw your white blood cell count was like through the roof, I'm like, oh my gosh, what is going on? I was a little scared. But once I heard you took the prednisone, it was understandable. And again, many people that I've met with, like what you saw on those websites, that's the only option they had. So they've come to me on either very high doses of prednisone or long-term use. And you probably seen Tiffany's testimony, the young girl recently that was on it's, for like almost a decade. And then in her 30s, every vertebrae in her spine was fractured due to the bone loss from the prednisone. And the statistics that 1 in every 2 women over the age of 55 had full-blown osteoporosis. So to put someone in their 60s on prednisone is like the only line of defense to a diagnosis is so dangerous. And also, in the fitness industry, we hear the leading cause of injury death after the age of 65 is a hip fracture. So this would be the worst possible scenario for you if that was the only option. But I completely understand, like a short-term use of prednisone may be necessary for somebody, but sadly for most people with these types of diagnoses, that's the only choice. And then they're just stuck on it for years because they're never taught the root cause and the symptoms don't truly go away. The prednisone just helps them get through it so that they can cope, just like you were trying to do to get some sleep during that first time. It makes sense. So
Right.
you lost the ability to lift your arms up, right? How are your legs doing? What happened with your legs?
I had to quit driving because I couldn't, I mean, it was very uncomfortable just to lift my legs to get into the car.
Mm,
Plus by that time we had talked and you had given me a plan, a food plan. You had given me the methylated B12 because you were able to, I'm really animate about doing my blood work and, doing my well checkups every year. So I was able to give you like, I don't know, what was it, 3 years worth of blood work
hmm.
before all of it happened. So that's when you saw that the B12 was just, I think it was 189 was my lowest. And, even though that's still in the normal range, evidently that's not normal for me and doesn't sustain me.
Yes, so no, what happened, and I was so grateful you had access to your blood work. And what was interesting, most physicians do not test B12 annually. Luckily, you really do have some amazing people that do awesome blood work, but they don't know how to actually utilize it for proactive care or treating a diagnosis. Many people do not realize that a B12 deficiency, really anything below 600 for some people, can create a variety of symptoms, and one of them being an autoimmune flare or nerve damage or the inability for the muscles to work right, even depression. And typically, when someone's low in B12, they may also be low in like folate or B6, and a low folate or folate deficiency can cause restless leg syndrome. So you had some of the early warning signs. And when I looked back at your blood work, like the 3 years prior, like it was like in the 300 zone, and the next year it went to the 200s, and then the next year it went to the hundreds. So if someone had caught that you were already kind of trending down and proactively treated it, you would have never had any of those symptoms or would have never experienced that diagnosis. Now, the blessing, the learning that you got from that, that was a good thing because you got to see, okay, this really makes sense. And so the norms for B12 in the United States range between 200 to 900, 200 to 1100, which is a really huge window. And multiple studies have shown that over 600, someone feels their best. So when I saw that you were in the threes, then the twos, and then in the ones, I knew for sure the hundreds was what was causing the nerve damage and where the body wasn't communicating. And there's studies about how that can link to an autoimmune flare. Now, right prior to this, and this is very common, especially in the fitness industry and all of us that are trying to be healthy, you had went through a more regimented health plan, like maybe intermittent fasting, and lost like 15 pounds, right?
Well, I had actually, I guess if you look at my blood work too, you see that I was trending with a higher and higher A1C too. So I
Mm,
know that a couple of years prior to that, I had done Whole30 because it
mm,
was like you need to like get on a statin, and I'm like, no, I know about personal training, I know about fitness, so I think if you let me like figure out a diet and exercise, and they were really good about that and said okay, so then they had me come back and it was getting better. So I think I did the Whole30 for probably 6 months. And that was tough, but I stuck to it. I got my A1C down, and then it's like, okay, it's down. And then all of a sudden things start creeping back in and you start eating different. So I thought, okay, it's time to get another checkup. So let's see, what can I do? So fasting was a new thing that was in. So I tried that, but I'm sure I'm just like everybody else. When you have your window to eat,
mhm.
things get in the way. I'm going to eat, but yet I never ate enough. I never ate enough protein. And so it didn't sustain me through that time of sleeping and going a little bit extra the next day before I ate again. So
Mhm.
that may have also played a part in the autoimmune.
Yeah, what's tough is that we're all trying to do our best. And what's convenient about intermittent fasting is you typically have to cook less times in a day, eat less times, and it's very good when you're busy with life. But exactly what you said, the intention with intermittent fasting is to get enough calories in that window that you have. But I, some days in a full day of being able to eat, even if I want to eat 24 hours, don't get enough time, so to speak, or make enough time to eat. So I know if I even attempted to do like an 8 hour window, it'd be almost impossible for me to truly ingest enough nutrients based on where my energy output goes. So it's very difficult in this day and age for many people to follow intermittent fasting the way it would be designed to be. And it's because we're so much different in the years 2025. than we were like, hundreds of years ago. We're facing so many more stressors that require nutrients and antioxidants and calories to offset free radicals, that it's very easy for us to become deficient if we skip a meal. And again, if someone's a little bit more apathetic or a type B personality, or maybe not as active as you are, they may be able to get away with it. But at that time, I think you were working for the garden center or doing your own garden, plus doing stuff for the fitness industry and working for a gym, right? And that's not including being a grandmother, a wife, right? In your 60s.
Yeah.
Yeah, so it's crazy. So you became what I would say almost completely disabled, at least 60%, if not more. And then you left working for the gym for a while, right? So that we could heal. Because I discussed with you that we had to conserve energy and focus on pouring into your body for you to have a chance at healing, correct?
Yeah. And you even said, pretend like you have the flu and stay on the couch. And I was like, but Kim, my husband doesn't cook.
Mm-hmm.
That's when he learned to make hamburgers and boiled potatoes. And that's what
Yes.
I ate for about 6 months until I finally could get up and start making some things for myself.
I know, and it's scary. When I first started healing chronic Epstein-Barr virus, I was so fatigued that I didn't want to cook a lot. And I also really wasn't into cooking. And even the cost at the time was like, okay, how am I going to be able to afford some of this food? So I literally stuck to like ground meat, hard-boiled eggs, some quality cheese, and pieces of fruit. And I just ate that over and over and over because it had every nutrient that I needed and had no additives, no chemicals that would slow down my healing process. And as long as I utilized those foods to get enough calories and then worked on my like mental stress and energy output, like everything healed. But it did take time. It took a year and a half I had a really good response in the first 6 weeks, but it still took a full year and a half before I felt like everything reversed. And so how long would you say it took for you to feel like 80% better and then almost 100% better? What would you estimate?
So that was May when it started. I didn't even go back to the gym until January, and I was a little reluctant then because I still didn't have the full range of my arms back as far as, overhead presses or, something like that. My goal, and this sounds silly, but it was, if I can't put on and take off a sports bra to go to the YMCA, then I'm not ready to teach.
I'm so glad that you use that. Some people are like, oh, I should go lift more weights, but can't put their sports bra on by themselves and don't realize that although we hear if you don't use it, you lose it, that if you use it ineffectively or push too hard too quickly, that you actually lose it faster. And so I'm really glad that you had some kind of litmus test to kind of utilize and like, I've got to conquer this before I do this. It's baby steps, And when you say go back to the gym, just to clarify for other people, primarily for teaching, correct? Because you were teaching group fitness and things like that.
Right. So I went back to 2 days, 2 nights a week lifting weights. But of
Mhm.
course, I didn't go back lifting what I lifted when I left in May. So
Mhm.
it was like, okay, I'm recovering from an autoimmune. So I still can't put a bar behind my back on my
Mhm.
back. So I'm going to show options and I'm going to lift less weight. So if you're new, we'll be lifting the same amount. And in January, that worked out great. Yeah. And
Good.
then I think I cycled a couple days a week, but it was only 30 minutes.
Mhm.
That was all I did.
Okay, you start off slower. Okay. And
Yeah.
then
And it was,
after that, go ahead.
sorry, didn't mean to interrupt, but it was
You're
also
okay.
nice too because I'd been home all that time, even if I wasn't pushing myself, which I wasn't, but it was just nice to be able to get back to people.
Hmm. Yeah, and we talked a little bit too, because again, food is a big part, but also for me, it was also when we talk about people, setting boundaries, knowing how I was going to react to other people and their stressors, because you're like me, you're very good at everything you do, you want to give it your all. And sometimes we viscerally digest certain situations in work and business, and we don't realize how much energy that's taking from us. So I know during that time we were looking at kind of observing situations, but not viscerally digesting them where they kind of get under our skin or irritate us or hurt us. Did you feel like you were thinking about that throughout that time you were at home in the summer?
Well, I never stopped working my event planning job because I worked that from home. But
Mhm.
when I went to the events, because I still had to go to a couple events, yes, that's what you're talking about. But what I was talking about was actually being able to see people every day and being able to converse with friends, or, have that, yeah, because I
Yeah,
I missed that.
yeah, you were grateful to get the interaction back.
Yes.
Yes, 100%. No, and that's true. And that's, this, I'm so glad you mentioned that though. Because some people that are in the healing process that are very much people persons and people, like how much I'm communicating and talking with people. It's sometimes really difficult when I say to them, look, we've got to conserve your energy. Even how many people you communicate with in a day is taking energy you don't have. And it's so hard. Just like if I have a marathon runner that loves running, I tell them we have to take a perceived step back, lay off a little bit to heal, and then you're going to leap forward. Just reducing our interaction with people, our communication, how many conversations we have, even telling our story or researching too much, it takes energy that we don't have. So we have to be on like a temporary stall, a temporary hiatus, and we have to go home, create a sanctuary there where we pour into ourselves, renew, and then we come back, and then we can be back with everybody again. Like you're with all these people again now, right?
Yeah, teaching classes, getting to see people. Yeah. So
Yeah.
that,
And
yeah, and to keep from being depressed because I was home all the time and I had nothing to do except lay on the couch. So yeah, I craved, but I did learn that I don't need as much interaction with people as I thought. That I like my sanctuary at home.
yeah, no, it's good to have a balance of everything. No, and then right now, how old are you now?
69 at the end of February.
Okay, awesome. And that's why I share that is because so many individuals may believe that they're too old to heal, or maybe their physician says, "Oh, you're aging. This is normal. We have to accept it." And I literally have people in their 90s that have healed stuff. So I just never want somebody to really believe that just because they feel like they're on death's door, or because of their age, or because someone has told them that they're incurable, that often there's many answers, that and it could be something small, like mostly yours was just missing B12 and missing specific caloric and nutrient needs that your body had to have to regenerate. So it could be something very minor, but that has huge impacts if it's overlooked. So I don't want people to assume that they just can't heal because of a diagnosis or an age or how they physically feel. How do you feel about that? Because there's times that you probably were losing hope on if you would actually really heal.
Yeah, because it wasn't like, everything seems to be immediate. Everything we do or get is pretty much immediate. And there are some things that you just have to wait for, and that was one of them. So I didn't give up hope because that's not who I am, but it sure was hard to learn to be patient.
Yes, no, and I'm so grateful that you were. And that's one thing too that actually did help us heal efficiently. That although you were thinking maybe there was, or maybe we might need some more prednisone, or we might need something to support us, your trust and your willingness to just keep applying the process versus kind of getting your own way, or how should I say, and this is not a good term, but let's say sometimes when we have to change or we have to be patient, we can have like little temper tantrums with ourselves or with even the person helping us. And that just gets in our way and wastes more energy. And so it's what I was so grateful for is really you just kept working on applying the process, trusting and having faith in your body and nurturing your body, because that's really what it's about. We we're always asking our body to do something for us and we're often ignoring it. And there's a time when the body's like, no, you're going to answer to me and you're going to meet my expectation versus your expectation. And a lot of individuals don't realize that we are made up of trillions of cells. And when those cells are damaged, they don't just all heal at the same time. When we have bone loss, like osteoporosis, it's typically site specific. Like it starts in one hip, then it goes to the next hip, and then it goes to the spine. So it's breaking down in pieces and it actually heals that same way. Healing is not like, oh, all the tissue just heals overnight. You have to heal in kind of layers. So you really allowed your nerves to regenerate. You allowed the muscles to regenerate, and you allowed everything in the body to get back to homeostasis by giving it that recovering time and then pouring into yourself so it had the materials to remodel the tissues with.
Yeah, and I actually poured into myself for that first probably 4 months, not just by food, but I also like did massage every week. And then
Mm.
as I felt better, then I kind of made it every 2 weeks and the girl that was doing my massage also learned how to do lymph massage. So, and she did reflexology, so I kind of mixed it all up.
That's amazing. And it's interesting in that book I wrote, The 111 Steps to Healing, like learning how to treat our body like a temple. I actually say that, like, get your care team, get people that can pour into you. And again, make your home your sanctuary. Where I used to go wrong with the healing process when I had symptoms. Okay, I have an appointment with my GI doctor, I have an appointment with the endocrinologist, the hematologist, and then you're at the pharmacy, you're at the physician, you're getting the labs done, the x-rays done. So it was all these appointments that cost more time and energy, and then also waiting on the results, and then the fear of not having the right answer, when all I really needed to do is go home and start resting, pouring into my body, and utilizing specific modalities, techniques, or nutrition for my body to just get back to normal. Basically, a lot of us are having a version of basically a nervous breakdown because the body's just spent. We've been burning the candle at both ends, and it just needs some recovery. And we think, okay, I've done 2 massages, I ate good for a week, it should be good. And the body's like, no, I don't think so. We're going to go a different route. Yeah. Is there anything else that comes to your mind that you would want to share with people as we talk about that?
Um, I think the only other thing that I could add is that, we were able to do a couple of the neuromuscular
Mm-hmm.
so that I could like work on a couple of things once I did start feeling better. I
Mm-hmm.
sometimes wish that we were closer so that we could do more, but yeah, that's why I want to learn so that I can, yeah,
Yes.
help other
No,
people or
yeah, no, I love that too. And that's a lot of people don't realize. What I loved about the interaction and how it worked is we do not live by each other. We never met in person throughout this whole healing process. We did a few virtual sessions for neuromuscular testing. We had another colleague come over and do the muscle testing. You did those correctives and some very minimal posture therapy exercises so that we did not exhaust your body. We kept it very like customized to you, but it was really profound that we could do all that basically through Zoom and FaceTime and through texting, as long as we knew what direction we were headed in, and I was paying attention to what feedback you gave me, what symptoms you told me, and we just adjusted as necessary. But some people don't realize that if you have the right team, it can all be done virtually. And that's what I love about with you and Angie. Denise herself just is getting trained as a Healing with Excellence practitioner and a neuromuscular specialist, because she has seen this offer so many colleagues results, and then what her healing process. So I'm so grateful she's going to start helping people heal in her area, and then also be part of our international team where she can support people virtually. And so in a way, just like what I went through, sometimes our diagnosis is our blessing, our test is our testimony, because when you physically actually live through something and you heal it, you can emphatically give other people hope without feeling like wavering. And it's so much better than textbook or the thing of like, there is no answers, there's no cure, there's nothing we can do. So when you personally live it and you go from feeling like it's like maybe never going to return these capabilities, and then you see even in your 60s that you can reverse everything and get back to even doing almost more than before and be healthy, it's a really awesome feeling to share with other people.
absolutely.
Yeah, no, I'm so grateful. So I cannot wait until you're doing this all over the world. Or I know, and I know I don't need to push you, but with that, didn't you just go to Greece? We could pick you up some clients in Greece, you
Yeah,
know, because I know you
right.
and Angie loved that. It was so beautiful. Okay, so I'm so grateful. And then your physician, after you healed that, did you guys discuss anything about the diagnosis, or did they tell you, oh, we must have misdiagnosed you? Did they have any answers for it?
No, my general practitioner is pretty open And he would listen, and I would say, yeah, I don't really want to go that route, and I have somebody helping me, and this is what she said she would like to see so that she knows what's going on as far as blood tests and that sort of thing. And he was like, okay, well, let's see what your insurance will pay for. And I'm like, I'm happy to pay myself if I need to, but this is what she needs. So he would do that. I still went to the
Rheumatoid.
rheumatoid doctor.
Mhm, mhm.
He was like almost sad that he didn't get a diagnosis. And when I explained to him what I was doing, he was just completely put off by it and didn't really want to listen or have anything to say about it. And I found it really strange that my sister, who is 4 years older than I am,
Mhm.
had a polymyalgia diagnosis probably 6 months to a year before me.
Wow.
And they, she's a nurse practitioner, so she took Tylenol to bear with the pain, which she said hers was just in her hips.
Mm.
But because of the things you had told me, I was like, so what was your B12 like during that time? Oh, it was low. And I'm like, I wonder if that has anything to do with it. So,
Oh my
because
God.
you had said, a lot of it was the B12 and the other things. So it's funny how they say they don't know what causes it, but yet, we had some similarities. So I don't
Mhm.
know what doctors are doing.
Yeah, it's super sad. And I mean, again, there's that handful that are amazing, but I've seen the same thing with other clients that went through the healing process. Rheumatologist, one of my clients at reverse osteoporosis, her physician, and again, she had full blown osteoporosis for like 10 years and she reversed it in her late 60s and she's in her 80s now. Well, her rheumatologist was like, oh, that's amazing. You're only 1 in 3,000 of my patients that's ever reversed it. And she tried to tell him what she was doing and they didn't want to know. They didn't care. He's like, oh, that's good. You keep doing it. I'm like, this is insane because they think she was just an anomaly, like a one-off, but it was because she actually was doing exactly what she was supposed to do, right? The
Right.
other thing is one of my other clients, when they tried to share what results they got from using the neuromuscular, there's somebody buzzing, someone using the neuromuscular, they said that that the doctor said, oh, that's not my lane. I stay in my lane. I'm glad it worked for you. And I understand they don't have time to learn all this, but it's just a shame to like say, hey, I could refer out to that person because none of these physicians lost their patients. The patients still come there. They just don't come as often or they're not buying the drug. So I don't know if that's the issue. So anyway, it looks like somebody's buzzing me for the next appointment. But Denise, I really appreciate you and I'm so grateful. And talking about virtual, I'm in Egypt and we're doing this right now. I'll be home on Wednesday, so I'm excited to see everybody. I'll be excited to see you next month for the neuromuscular course in person.
Right.
But thank you again for your trust and your amazing perseverance, and thank you for helping others. I appreciate
Not a
it.
problem. I wouldn't be here now if it wasn't for you.
Oh, thank you. And you have an amazing night. And thank you for teaching all those people how to be fit safely.
All
Talk-
righty.
Bye,
Thanks.
hon. Talk to you soon.
Bye.